Our meeting is now being recorded. Thank you so much for joining for our quality leader session. We are so pleased and proud to be hosting Matt Prasek of How's Mom. Matt is really a visionary leader in our industry in the post-acute sector. He's the founder of How's Mom, which marked its inception as the first patient portal in senior living. Matt started his journey being inspired by his grandfather, and I think that he can share his background with us much better than I can. But that knowledge and expertise has been applied into crucial areas, including electronic health record integrations, HIPAA compliance, patient portals, and pioneering family engagement in senior living. This led to a deep understanding of the Cures Act and patient access, which is really important to us in having an impact on how we do our work now in the post-acute sector. In his leadership roles, Matt has led engineering teams as a chief product officer, streamlined processes as chief operating officer, and harnessed the dynamics of building and leading high-performing sales teams. As COO and a board member, Matt's strategic direction has been pivotal in aligning the growth and mission to create a better experience in senior care. His journey at House Mom began with introducing one of the first patient portals for senior care, advocating for transparent and immediate access to information with electronic health companies. His role as founding partner in Point Click Care and Matrix Claire's integration programs, which are the largest EHR systems in senior care, has been crucial in making health information more accessible to residents, clinicians, and families. The House Mom solution aligns with the Cures Act of goal of enhancing patient access to health information. Adapting to the challenges presented by COVID-19, House Mom has evolved into a comprehensive communication management platform addressing a spectrum of needs in senior living facilities and has led to significant insights in understanding what the customer journey looks like and the changing faces of our changing needs of the customer expectations in senior living. We are so proud to have Matt with us. And at that, I'd like to turn it over and welcome you to the Quality Leader session. Thank you, Matt.
Yes, thank you so much, Listen. That was a wonderful introduction. That is absolutely hard to top. Very, very thoughtful. Thank you for that. I'm just really excited to get in front of you all. As Alyssa alluded to, the past decade, my entire career has been working with senior care providers, electronic health record companies, help creating workflows around communications, connecting, all of these critical parties in senior care, residents, staff, families, all of these stakeholders with the right information so that we can promote better outcomes and better quality for our aging populations. I think, it's really, really important, when we look at, how we're measuring the quality of care, the customer experience, and um, you know, I'm absolutely passionate about this because of my own personal experience. We started the company about a decade ago in 2015 and really was based off my personal story. I was in school and I had a grandfather with a traumatic brain injury unexpectedly. And as a result of that injury, he resided his last 2 years of life in a skilled nursing facility. So, you know, prior to that, I didn't have much experience in senior care. So, I really got to live that customer experience and just understood the challenges on both sides, right? And wanted to create a better way to communicate for providers that helps save nurse time, drive different efficiencies so that they can reallocate that time to providing the best possible care. And you think about these nurses, there's a lot of very caring people in this industry, right? And they're very much asked to do more with less. They have to communicate so many different things to different people, and it can be a real challenge, right? And taking care of all of these residents. So, yeah, I'm just really excited and share some of the insights that we've learned as a company, over the past decade of, what's important to families. And, when we use the word customers, we refer to the residents and the families, right? Because, based off of different acuity settings, whether it's skilled nursing, assisted living, independent living, those stakeholders can be different. And, for example, in a lot of the ILs or assisted living, the residents themselves may be big part advocates of the care that they're receiving. And then, in higher acuity settings, family caregivers may be more involved. And it's just been really great to be able to connect those pieces and learn from all of these populations, of how we can provide the highest quality of care to our aging populations. So I'll start out with customer expectations, some of the things that we've learned. Um, this is a McKnight's case study that actually surveyed, hundreds of family caregivers and really was tying in that communications experience to the quality of care that they're receiving. And this is something that we see every day, in our company as well. Especially, in the skilled and AL markets, like that communications experience is so critical, right? You think of these family caregivers, how much care coordination that they have to do, especially if that resident's needs are very high, right? Like in my grandfather's situation, we were often communicating to neurologists, other outside parties, things like the medications list. And it can be challenging, right, to sometimes get that information because of the industry challenges. And I mean, this just shows, 50% of the family caregivers were satisfied with the amount of timeliness and information they received. But, the ones who did not receive information on a timely manner, they're just as concerned with the quality of care that their loved ones receiving. So, the more that we can bring in these caregivers and these stakeholders, it creates a better experience even for that resident. There's lots of studies involved with, resident outcomes in the senior care space. And, when their families are actively involved in the care that they're getting, not only is care coordination easier, right? For the provider, for the residents, for the staff, all parties really benefit from this. And I'll be talking more about, sharing information and, ways to do that and some of the upcoming regulations I think that are really important. Um, and this is impacting healthcare as a whole, but, specifically the impact that it's having on senior care. So if you think about how we communicate in senior care, right? We've been communicating the same way for the last 40 plus years. And, we think about all of the challenges and that customer experience. I mean, um, most times when a family member needs to get information such as a medications list or an update on the care plan, right, to be able to communicate that with another provider or another clinician, uh, there's three touches, right? So typically they call the facility, they get a front desk. If it's a care related question, that front desk is going to connect them to that nurse's station. The nurse that is at that nurse's station is going to pick up the phone. They're going to ask, which resident you're calling about. They're going to authorize you over the phone, look in the health records, hoping that you are who you say you are, right? And then they're going to wave down the primary caregiver who's normally administering care on the floor. So, you know, it's typically a long, experience to or a timely experience to retrieve that information. It involves, even simple things like medications involves a lot of staff members, and also requires documentation, right? So we look at things like resident rights, things to drive quality of care, and documenting these communications is really, really important, especially to make sure the preferences and needs of our residents are being met, right? If we're creating a resident-centered care model, we want to make sure that that documentation on those communications are reflecting in the care plan, right? It's getting to the right people. And I think the challenge with, senior care communicating these things over the phone is making sure that the right information gets to the right person, right? So that we implement and execute upon those things. Because phone calls, sometimes aren't actionable, they're not visible. Like we don't know the communication that that nurse just had with that family member. Did we resolve the issue? Did we, if she had a grievance, did we document that properly for our state surveys? I mean, just really trying to get the visibility on this. And it all starts with the documentation, right? And we know that the communications experience is so critical, uh, and the types of insights that we can get from family caregivers is highly, highly important because, these families know the residents the best, right? They've been with them before they got into your community. They may know insights into that resident's care that, is not in the medical records. All the time we see family caregivers communicate things like, hey, notice the new medication. Um, you know, Mom was on this medication 10 years ago, and we saw a rapid decline in weight, right? Is there an alternative? Like engaging stakeholders into those types of things can help you as a provider create that resident-centered care experience, right? And be able to measure that and show for your ratings and reimbursements that we're exceeding the needs and preferences as residents, which I think is a really important piece because so many times we're looking at, how we measure quality of care and focus, on readmissions, and that can be a little bit subjective. Like, there's a lot of variables involved with that. The resident came from the hospital, were they ready to leave the hospital, et cetera. And this is really something, from a provider perspective that we can control, right? We can make sure that we're collecting insights from those stakeholders to create the best possible care for that resident while they're in our building. And make sure, that their preferences are being addressed. Another medications example that I see quite often is example that type of insights that families can provide is, hey, past couple weeks, mom has been nauseous, from her meds. She told us that, she's receiving them a couple hours before breakfast. Can we administer the medications with her breakfast? I think that can help, right? And I mean, it's just so critical to be able to get those types of things, even, activities, things like that, can really help with their mood, right? If they're, um, we're trying to get more social interaction out of the resident and we're taking them to, bingo or whatever it may be. And maybe they're not that big of a fan of bingo, but they're afraid to, tell the staff that. And, but they're telling their families, right? And their families can help then be an advocate in their care journey and communicate that to providers so we can make those adjustments. It's really important to make, adjustments to the care, especially, in these higher acuity settings. It can really impact the outcomes. And, it also can be a great way for referral partnerships to show, that you're building a residence centered care experience in your buildings, and you're able to coordinate care across all of these parties so that everybody is interconnected to make sure that that resident has the best possible outcome.
Matt, that's such a fascinating point to bring up. I think that uh, can you confirm for me that the dynamic has shifted, that our residents and patients have a stronger reliance on families to help communicate their needs and desires? I would have thought that with the silent generation moving out and baby boomers coming in, that they would have had a stronger voice, but it seems that that might be shifting. My perception might be off.
Yeah, I mean, we see that all the time. I mean, this is data that we collect from our customer service channels. And, we look at that very closely and, we see strong family advocacy. And I think it's directly correlated to the level of care that those people need, right? So, for example, someone that's requiring a higher level of care in a skilled setting, there's mental cognitiveness, like whether, they're able to advocate for themselves. They may be, in my example, my grandfather was in a coma, right? So, he was coming in and out of a coma, and my grandmother was pretty much living in the room, sleeping on a couch. And, when he was awake, he would be able to tell her things, but maybe, a nurse wasn't there right at that moment to hear those things. But yeah, I think, when you think about the dynamics of senior care, and nurses are incredible, right? This is not a negative light on nurses at all, but just that comfort level that they have with their families, right? It may be easier to be able to express, certain preferences and needs that they have. But, how do we loop that back to the provider? Because it's incredibly important, right? And giving family caregivers that voice, that channel. We found a lot of success in giving them a 24/7 channel to be able to communicate into buildings. And, from a provider perspective, it's much more efficient than communicating over the phone, right? Creating these channels to where your customers can communicate to you. And in lower acuity settings, it may be the residents themselves utilizing these channels, right? And I know I've worked with a lot of clinical teams around their morning meetings, right? So that we look at everything in that channel and it's now actionable. It's now visible instead of, the 20 phone calls that several different nurses took yesterday. Like, how do we make sure that we did everything we were supposed to do? Like, how do we manage this communications process? Because we understand, like, the challenges, in the industry is you have staffing shortages, increasing regulations, rising customer expectations. COVID shined a negative spotlight on the industry that I think, is unfortunate. Didn't highlight some of the great jobs that caregivers are giving on caring for our elderly population. And I mean, the common theme is providers are constantly being asked to do more with less, right? And senior care can be a challenging environment, especially when you think about, the customer journey. So, when a family is very involved, typically in choosing a community, and, when it comes time to put their loved one in a community, there's a lot of grief in that process, right? Like they are admitting to themselves that they are no longer able to care for their loved one. So, at the point of admission, they're going to be constantly comparing the care that they're receiving at one of your buildings to the care that they would be giving, right? So, meeting those customer expectations is really difficult. And I think, the number one way to do that is to give customers a voice, right? And be able to get that information in a way that's going to be more efficient for organizations. So, like, they can measure we're meeting the needs and preferences of our residents. And it can be often really hard to do because of, CMS's alignments of how they're measuring quality of care. But you can also take this data, to show that, right? If you get low quality scores, be able to show CMS, hey, we are exceeding the needs and preferences of our residents, well, that the readmissions we had last month does not represent the type of care, that we're providing at our building from a quality perspective. And I think that's the big missing piece in, our system is when we're trying to measure quality of care, we don't ask the customer in senior care. Now, you look at hospitals across the care continuum, HCAP surveys are more standardized, right? They're getting more of that voice of customer and intertwining that to impact their quality scores. But, in senior care and senior living, um, the standardized HCAP survey is 50 questions long, right? So providers have to uh, lick a stamp, put it in the mail it out to, the families, and you're probably only going to get the ones to respond that had a negative experience, right? Like that's one of the major motivators to where if you gave them a 24/7 channel, you're picking up all of those things, right? You're making it easier for them to know like the strengths of a building, to know what some of the challenges are. It can streamline, documentation such as grievances, but also, then intertwine all this information with your QAPI strategies because, a lot of QAPI strategies that we've reviewed with our customers can be primarily driven off of survey results, right? And there are tags, associated with complaints and things like that, but that's only if the family member calls the 1-800 state number, right? And it starts an investigation. Like, how do we be more proactive as an industry to get to it before it becomes a formalized complaint or grievance? And I just think one of the best things that providers can do is create that customer service process, that channel, right? To really harness the voice of customer because it impacts outcomes, it impacts their reimbursements, it impacts all of these critical things to their business. And I just see it as kind of an underutilized thing, family engagement. There are a lot of providers that are great at their family councils and involving families more. But those can happen at like infrequent times, whether you're meeting with them on a weekly, monthly basis, right? Versus, giving them that channel. Because the number one complaint in senior care is delayed response times, right? And that's something, that's true. Like we see that all the time. And, if you think about, okay, what do customers want? Like, how can we help create a better experience for our customers, drive a resident-centered care experience? I mean, the answer is that your customers want to communicate with their care providers and senior care how they communicate in their everyday lives, right? So if you think about, as a consumer or customer, your experience with any type of healthcare or, any type of services that you engage in, you want information readily available at your fingertips. You don't want to have to, Google the facility's number or look at that post-it note, inside the kitchen that you have, or look up the address and have to drive there and call and get the front desk. Those average calls are taking over 40 minutes. So, being able to create that channel allows to create better response times. It allows to be more interactive with the families. But, here's some data we've been collecting, over the last decade. And, some of the ways that providers can make information available to their customers is through portals. Portals are just starting to come into senior care. But not just making health information available in these portals, but be able to create, customer service lines and things like that through them is really the provider value, right? So that they can collect these types of insights and align their operations with them from a quality perspective, from a staffing perspective, all of that. So, we see a majority of the populations out there, and this is data collected from around 37 different states and different acuity settings, CCRCs, assisted living, independent living. The number one thing is they want information readily available to them, right? When they need to call a external caregiver uh, regarding their active medications or what we're doing from a care plan perspective, Like they just want to be able to have that so that they can advocate for that resident and communicate it to that other stakeholder. So connecting the populations is super important. So some of the, I think, communicating, it's really important to take an omni-channel approach. So when you think about your customers, there's some challenges uh, regarding how we communicate and to do effective communications because, from a provider perspective, compliance, right? You have compliance hinging on being able to effectively communicate. You have to communicate for, 5% weight changes, new medications, change of conditions, care plans. When we analyze surveys, in different types of communities, I think the two biggest, deficiencies and tags that we see are around change of conditions and care plans, right? The 48-hour baseline care plan, constant care plan conferencing, et cetera. But, you know, and landscape or geography can impact this as well of how your customers want to be communicated to, age demographics. So, we've seen to get ultimate coverage in your communications, you really need to be able to do it in the critical areas, app, web, email, text. Those are really the four channels. Um, and obviously when you're communicating health information, you have to do that in HIPAA compliant ways. We can't, do emails and text messages, but there are some communications to where we can do in those channels, right? Like updates and then, sending them to the portals to be able to see the actual change where it's protected and then, creating workflows to document back into the health record. So, you're ready to go for your surveys and you can prove, we communicated to the right person at the right time every time. But yeah, I think, a lot of communities don't think that they have smartphone users and they may be surprised, right? A good percentage of people who are able to use apps, whether they're daughters and sons, care POAs, like emergency contacts, like these are the typical roles that we have to communicate these types of things to. So you can see, a large majority of portal usage is driven around mobile apps. Web can also be a very good stopgap for those people who don't have smartphones, right? Almost everyone has a computer at home and, can Google things and go to a website, right? And log into a website. So that's a great way to, cover the population that may not be smartphone users. And then text, messages far outweigh, the other types of communications. And those are really need to be like update driven, right? Like event driven, and social as well. I mean, just being able to communicate, different events happening in your buildings, like we have a family night, we have a movie night, those types of things. Because if you think about the customer experience, and based off the acuity setting, like I see most communications in my IL settings probably more geared towards the social side of things, right? There can be a little bit of care being provided, but it's a little bit more less frequent than, say a skilled setting. And then skilled setting, a lot of the focus is those care communications around conditions, around care plans, et cetera. And then assisted living can be, a little bit of both. We're seeing a shift in, the needs of residents increasing in these different settings. So, assisted living is providing more care than they ever have before, right? Like they're getting residents that have more needs and preferences than they're probably typically used to over the past like 20 years. So, they're very much adapting to the needs and preferences of those residents, and they're providing more care than they're used to.
Just a quick reminder and check-in. Does anybody have any questions? You're welcome to unmute and jump into the conversation or type the question into the box. in the chat box.
Yeah, feel free to shoot any questions our way, guys. Really enjoy working, with providers on these things and looking at, what benefits are to them, how to create those customer service channels, how to connect external and internal caregivers, with health information. It's just really important because, you look at electronic health records, right? Your point click cares, matrix cares, Cerners, of the world, they're really not designed to document communications, right? And, providers are required to document these communications. So oftentimes they lack standardization, right? And we're throwing them in the catch-all of progress notes. And, they may be called Nancy. Well, who's Nancy? We need to make sure we include how we communicated with her. We need to make sure it's time stamped what we communicated, when, that's the proper format of communications from a documentation perspective that I think a lot of facilities can really benefit from. So you may be wondering what information can help family caregivers coordinate care, right? Because if we want the highest quality of care in our communities, being able to give this health information is critical. We've seen vitals being very, very important in getting family caregivers more engaged in the care. Also, can decrease a significant amount of call volume, giving nurses back time to be able to focus on care, which is a big piece, right? Like we want the right communications. We want, I think when providers communicate in the right way, it's less of, hey, what was mom's weight yesterday? Or it changes the conversation to, hey, we've noticed mom's been gaining some weight, looked at her food choices. They're helping be a part of that care planning process and can connect dots, maybe that we're missing, and we're empowering them to be a part of that process. Medications, obviously a very, very big one. Um, you know, Being able to see an active medications list. I can give a story when I was first starting my company, very early on, we had a retired school teacher up in northern Indiana. He was 85 years old, and had a multiply disabled son residing in a skilled nursing facility. And monthly, the retired school teacher had about 10 outside appointments that he was taking his son to, right? Because of the level of care that he required. Now, for an 85-year-old man, it can be a challenge just driving to that facility. And that's what he was doing because medications were changing on a constant basis. He was getting in his car, driving to that facility and having them print out a medications list so he can take it with him and his son to all of these appointments. Um, and I'll tell you, an 85-year-old was one of my highest portal users. I mean, it was so important to him and helped him so much to be able to communicate the medications to these external caregivers. And it's kind of funny, we've had a long lasting relationship. I helped him set a printer up in his house, like several years ago. But it's just amazing of, you know, how thankful, the gratitude, peace of mind, transparency, and helping these people. And as providers, we can do this, right? We can create this experience for them and also benefit, right? I think there's always a lot of hesitancy around sharing clinical information, and rightfully so. Understand the challenges around charting, best practices. But the consumer expectations in the world that we live in today, it's really hard to meet those expectations without making information readily available to them. And, you know, hospitals, have seen this, right? They've been doing this for the past 10 years. And now I think we're starting, because of COVID, senior care move into this world and really adopt these types of mindsets. Yeah, so we have obviously done a lot of work with portals and we talk about like consumer insights. How do we get consumers insights, to be able to measure like qualities. And this is just an example of what sharing critical information can do for providers. So, we A/B tested across 24 skilled nursing facilities and we were having them consistently rate the quality of care, right? And this could include resident scores, family scores. These are the customer scores, and 1 through 5, pretty aligned with like a 5-star rating, and having them rate that. And what we found is the 12 facilities that made information available to family caregivers, they doubled their scores, their quality of care scores from their customers. I mean, it's just huge, right? Not to mention, efficiencies that the providers gained, but, from a quality perspective, the residents and families were very thankful for that because they were used to having to call into, you know, communities every day to be able to retrieve this information. And, the nurses, you think about their experience being asked to do more with less, like by making this information available to them, it really helps them allocate more time to providing care. It can be really time intensive for providers. And then another really interesting metric is, 25% of the new admissions in those buildings said that they selected those buildings because of the communications experience. So peace of mind, transparency, those are so important during facility tours, in that pre-admissions process with your referral partners, being able to create that resident-centered experience. I always tell this story. I've been involved in a lot of families when they're getting discharged from a hospital and selecting, a location within their network for the resident or patient to be able to get therapy services or whatever care services that they need. And historically, it would be one of the main drivers was location. All right, they wanted somewhere that was convenient, close to their house, because they wanted to be connected with their loved one, right? And that speaks to that peace of mind and transparency. But what we've seen now is, if you have your choice between facility A, B, and C, and if you can make this information available to them to be able to drive that peace of mind and transparency, they're willing to drive further, right? They're willing to select that community, if they feel like they're going to be a part of the caregiving experience, right? If they feel like they're going to be engaged, they're going to know things like what did mom eat? They're going to know, what her blood sugar or blood pressures were, right? They're going to be able to monitor their weight. Like those are the questions that caregivers have on a daily basis, right? And if they don't hear from their provider in, a couple days, you have to think in their mind, they're like, oh my gosh, is mom okay? Right? Like what's going on, and we want to be able to give them that peace of mind because I think it can drive a lot of value, not only to them, but to the providers as well.
Yeah. Matt, we have a question in the chat. Uh,
Yeah.
Peggy is asking, how have facilities been successful with improved family communications and less complaints? And more specifically, do various disciplines share the responsibility and ownership for communication via the app or web?
Yeah, great question. So, when you're looking at communications and how to do it, obviously, technology is a great avenue to look at, right? And happy to share, we have steps on how to evaluate technologies that are best going to align for your organization because not every organization is the same, right? Like it's one thing that I've learned from servicing these different care environments is they need a very dynamic solution. So, for example, what independent living wants to communicate and skilled nursing can be very different, right? So you need to be able to communicate social health information care, all of these things. We when we go through implementations, one of our approaches is to look at, their survey results and look at, what known deficiencies do they have? Is it around care planning? Is it around admissions? Is it around discharges? And then what communications can we automate to help them around those processes to reduce, those deficiencies? So we take a probably pretty unique approach. I mean, I would say, in all of these care environments, communicating care can have a lot of provider benefit, right? And that's typically, the focus is on a lot of the communities. The social communications are very, very important. And I don't want to belittle that at all. You should have a mixture of both. And then from the provider side, the disciplines question, uh, most environments that we work with, different people are in charge of communicating different things. Like social workers are doing a majority of the care plan communications, right? You may have unit managers communicating a lot of the transitions, whether it's admission, discharge, et cetera. So, being able to create these workflows to where they're going to the right person, that's going to drive the most value for the organizations because, I think there's a lot of family engagement solutions that are more centered around the social side of things. And that's great. I think there's a lot of benefit there, but, being able to also communicate that care is an important aspect of that. You have to be able to communicate all of the things and make sure it gets to the right people. And then making sure that it's completely integrated into your EHR, right? Because the reason these challenges exist is because you guys, nurses, the most important asset of these organizations, are being asked to do more with less, right? So our focus, and I think, providers' focus should be zero change management, right? Like how, based off of how we chart, how can we enable these communications not only to go out, but be documented into our EHRs to drive higher compliance, drive quality, connect all these stakeholders. Additional documentation is not a solution to the communications gap, right? And we understand we work with a lot of clinical leaders and nurses, at communities and try to make that as effortless as possible. And, I also think it's important that these communications go out in a variety of delivery methods because you may have families and care POAs, which in a lot of cases, those are the people that need to be notified of things such as change of conditions, those types of communications. They may prefer text messages over logging into a portal, right? So you have to make sure that it's bi-directional. You want to make sure that you can trigger communications going out based off your standard charting processes, but also have those communications come back into your system, and very aligned with the work you all are already doing. Any other questions? Thanks for the questions, guys. I really, really, really appreciate that. But yeah, I was starting to talk a little bit about the documentation, right? And earlier we spoke about, EHRs aren't really designed to document these communications. So oftentimes they go into a catch-all of a progress note. They can be hard to retrieve when you need to find them, right? Because you have
Yeah.
doctors, nurses,
Yeah.
all documenting this into progress notes and, like infection control, obviously, was really big through COVID. We managed a lot of those communications, but, making sure that they're standardized and formatted in areas where you can easily retrieve those communication logs from a compliance perspective, from a liability perspective, because these communications, if you look under resident rights and all the times that we're required to communicate, we want to be able to make sure that those are formatted correctly, they're time stamped, they have the who, what, when, where, right? Like all of those things. And some of the areas that I think are really valuable for providers, I mentioned creating the customer service channel, right, to where they can communicate, you know, 24/7 with setting the right expectations of creating it designed around your morning meetings with your nursing staff, so that you guys know like what we need to do, right? And you can be able to track those and see, what issues, who we need to communicate to. Like we've seen through those types of processes, we've seen a reduction in communications over the phone by 80%, right?
Wow.
Because you're doing the important communications, right?
Yeah.
You're not just communicating because you have to. The 20% of those communications are around human empathy, customer service, right? And that human touch is so important in this industry because we're caring for loved ones, right?
Mhm.
And, you know, is a ton of hard work that's involved with that. And if we're able to, show the work that we do and communicate that and really connect with those families, it's just so important, but there's things like, blood pressure, weights, things like that. Like by giving that information readily available to them, you create more resident-centered conversations. They're participating more in those care plan meetings. Like they're part of your team to be able to make sure their loved one is progressing, right? But yeah, I think, the types of things that you can see, in the customer service channel and help like automate, some of the documentation or incoming and outcoming calls. We talk about preferences and needs, super important, the center of value-based care.
Yeah.
But how do we measure whether we're meeting the preferences and needs of our residents, right? And creating that customer service channel, you can see what preferences and needs are coming in, right? Like you can take a more analytical approach, intertwine that into your process improvement strategies, right? To really commit to your building, driving the highest quality of care possible. And then grievances, we can't be afraid of scary information, right? Um, I work a lot with clinicians on this, and pre-COVID, I mentioned, clinical hesitancy, right?
Mhm.
But the reality is, if they have a problem and they're not able to get a hold of you, they call 1-800-STATE, right? Which is then we're reacting,
Yeah.
like service recovery in this industry, like we want to be proactive, right? We want to know that information so that we have the ability to communicate with that person, inform them and educate them. A lot of it is, around they may just not know what's going on, right? They haven't been able to get into the buildings for a couple of days. We might have not gave them a call last week, right? And just creating, you know, that process to where we're funneling it into us as a provider to be able to address those. I mean, we see a significant decrease in complaints, significant decrease, because at the end of the day, we found that families understand, right? Like they understand the challenges of the industry. And if we overly communicate with them, they're much more willing to be on our side, to have, that grace
Yeah.
with us as providers. I mean, we work with insurance entities as well and work a lot on, satisfaction scores and how that's correlated with claims.
Mhm.
And I can tell you, there are almost zero claims to where the residents and the families said they are a transparent organization. I felt peace of mind. It's kind of a, fallacy in the industry where, we feel like sometimes we need to um, not be overly transparent, in our health information and charting. But I think, it's really important to consider the 21st Century Cures Act too. And I know
Mhm.
we're running at the end here, so I'll just jump ahead a little bit. So, there's a lot of industry experts, comparing this to the next HIPAA. This impacts all of healthcare. There's a lot of senior care that is just now being made aware of this. It's been evolving legislation for over 10 years. We've been watching it evolve as it goes through Human and Health Services, Congress, all of that. And it's behind really big quality of care initiatives, right? It's behind cancer research, the Moonshot Foundation, all of these things are intertwined. And what Congress has said is that they want patients to own their information. So, they have passed this law. Um, the penalties and disincentives were just announced last month. So, we're patient access is really important right now. Families, authorized individuals, and the residents themselves have to be able to get readily available access now to their health information so that they can coordinate and advocate for themselves to be able to receive the highest quality of care. The industry is very used to things like medical record requests and things like that. This is federal legislation, um, and has a pretty stern tone. As I mentioned, they just announced the penalties. So, there can be civil monetary penalties up to $1 million per information blocking. So, obviously, just like our tags and deficiencies and surveys, it's based off of severity and scope, how many people were impacted. But it's very important that we're coordinating care differently than we have, in the past. And we're making this information more accessible. And, families now can call into the OIG, just like their state numbers, and it can trigger surveys and things like that. And with the staffing challenges, I mean, it can be very beneficial for providers to start adopting portals and customer service channels and these types of things with keeping in mind, the customer's expectations right now. So that up to $1 million penalty went into effect July 1 of last month. And then uh, there's another penalty to where organizations that are part of ACOs can lose ineligibility with their Medicare shared savings plans for up to a year. So, we are doing a lot of education around this. I think it's a big change for senior care. Hospitals are already there, right? They've been doing, a lot of those portal communications over the past several years. But now that it's enforceable by CMS, it's definitely something to look at and make sure that, you're compliant with all of the USCDI data points within your EHRs, that your families have ways to be able to get that information very easily.
Thank you. Wow, that's one more thing to add to the list to take a look at today, huh? Uh, for a provider, Matt, do you think that the recommendation to take a look at the Cures Act would be to um, work with the administration leadership of the skilled nursing facility and connect with their IT provider
Mhm.
to take a look at their EHR and start working through milestones on how to break down this law and make sure you're compliant with it?
Yeah, absolutely. I think, there's a variety of different ways. It starts with understanding, what data points that we are going to have to make accessible to our families now, and then aligning that with charting practices, right? That's kind of the foundation that we work with a lot of providers on, because this can be a little bit of a culture shock, for a lot of the senior care customers and you really are senior care providers. So, evaluating how we're charting things like progress notes is a very difficult one, right? Being able to clean that up and, make sure we're structuring it more because these are now have more visibility over them, not just with residents and families, but also, other clinicians. So I always think that's step one, right? Is look at that. And then step two is definitely looking at, different types of solutions that are out there. Just a traditional patient portal, I think, doesn't align very well with a lot of the needs of senior care. To me, it's really about intertwining, customer service, looking at, your survey results of like where are areas that, we may have got deficiencies in the past that communications will enhance, right? And look at, automations and different technologies to be able to leverage the charting that you're already doing.
Yeah. Wow. Thank you. Um, got a couple people that are jumping off. Before you jump off, just a reminder, the recording is available on our YouTube channel. If you want to go back to it and take a look at it, and we'll be following up with some information to all of you. Matt, any final words of recommendation for us?
Yeah, I think one of the things that we is really beneficial to providers is creating, an internal communications committee and looking at, things like voice of customer and like involving different roles of your organizations into that, right? Because communications can be like a broad topic, but the typical roles that I think should be involved in that communications committee to look at things such as the Cures Act, survey results, because it impacts so many pieces of the business, should be, risk management roles. It should be any experience or customer service roles, in the organization. Clinical leaders should be involved into that. And I think it's just been amazing when you get the right leaders into that, looking at the different types of workflows and automations that you can use. I mean, significant value, based off of the initiatives for the organization. If it's saving staff time, is it reducing tags? Is it becoming more compliant? Any of these things. But I definitely would recommend looking at how you can create that internal structure within your organizations.
Yeah, that sounds fantastic. And, it's just so reminiscent of a QAPI action plan. As you're talking, it's very reminiscent of how we're doing our assessments and developing information and pulling it back through the QAPI process. Um, this may be a great opportunity to look at what what I've heard referred to as lived experience and involving some of your family or residents in some of these systems and processes to get that feedback and build those systems even tighter. Uh, aligns with CMS's expectation of incorporating families and residents into the QAPI process. And so you got a twofer. Not only are you meeting the regulatory requirements, but we're also really getting that involvement and engagement and understanding what's most meaningful for our customers. Matt, this has been a fantastic and very thought-provoking presentation. It's generated so many ideas and concepts in my head, and I just really want to thank you for your time and for leading this information for us. Do you have contact information for anyone that has any additional questions or follow-up for you?
Yeah, absolutely. And feel free to reach out. I'm a resource. We have helpful Cures Act information for organizations on, looking at what they need to know and how to prepare for that, as well as, how to evaluate communications technologies and et cetera. My email is pretty easy. It's Matt, Matt, at howsmom.net. So, any of the listeners, feel free to reach out to me. And Alyssa, I greatly appreciate just being able to get on here and talk with everyone. It's been great.
Thank you so much. I've dropped your email into the chat box so everybody can have it. Um, thank you again for your time, and we'll have this available for you on our YouTube channel. Thank you, everybody, for joining us, and hope that you have a fantastic week. We'll see you next month.
Bye, everyone.